Hi, I'm Dr. Dan. I'm here with a veteran on Veterans Day, and I want to introduce you to Jake, and he's going to share his story. So, Jake, this is just such a cool story, and I wanted people to hear about it. So, tell me a little bit about your background and what led you here today.
Whenever I was in the Army, I was a route clearance EOD specialist, which basically means I went out and found IEDs and disposed of them.
So, what's an IED for someone who might not be aware of
It's
it?
an improvised explosive device. It's basically any type of explosive material they can bury in the ground or even put inside barrels, whatever.
Okay, okay. So, what years did you serve, and where did you serve at?
I served in Iraq for my first tour was 26 months, and my second tour was 8 months because I was wounded.
Okay, what happened with the when you got injured?
Um, the third time I got injured real badly, it shattered my legs, all my teeth, and just messed up my back and everything.
So what happened, with that? And you told me that you were, you obviously being a specialized, officer with the IEDs. How many experiences did you have with explosions?
I have 32 direct blasts.
32. And what's considered a direct blast?
A direct blast is anywhere within 26 meters of the original explosion.
Okay.
Within 26 meters, it's usually going to pick you up and throw you back. It all depends on how big it is.
So you had 32 experiences where it literally lifted you off the ground and threw you to some extent.
Yeah.
Now, what was the result of all the injuries and experiences with those blasts?
I have a severe TBI.
And TBI, for people who don't know?
Traumatic brain injury.
Okay.
As you know, I have severe frontal lobe damage and parietal lobe damage.
Okay. And what's been the result? What health challenges do you experience on a day to day?
Just horrible headaches is what I was experiencing.
Okay.
I mean, for the past 3 years, I've had headaches every single day. Horrible headaches, my back. Sometimes it's hard to get out of bed.
Yeah. And you're a young man still, right?
Yeah, I'm only 32, yeah.
But you probably felt like you were...
Oh, I felt like I was 65, 70 years old rolling out of bed.
Okay. So what was your first experience with chiropractic care? Because it wasn't you, it was a family member, right?
Correct. My daughter, I have a 6-year-old daughter, Kayla, and she had severe acid reflux. And we tried everything, going to the pediatrician, doing this, doing that. And we happened to run into you.
It was actually just the day before. I remember this. It was like the day before you were gonna have her scoped, right?
Yeah, it was the day before, and we elected not to do any procedures on her. She's a 6-year-old, so we sent her to you. And after sessions with you, Dr. Dan, she has no acid reflux anymore. Nothing. Before, she couldn't eat anything after 6 o'clock in the evening.
Yeah.
Because of her acid reflux.
Yeah.
Now,
anything, anytime, right?
anything, anytime. It's unreal. And I saw her, and I saw how far she came along, and I decided, hey, I need to go see Dr. Dan. I need to get healthy.
Yeah.
I need to get fixed.
Yeah. And that's what, because you were in a significant amount of pain, right? I mean, day in and day out.
Oh, that's very true. My pain level was just excruciating, and I don't take painkillers or anything like that. I just don't. This is my personal beliefs. I don't take that stuff. But yeah, I was in severe pain, especially in my neck.
So neck, and you talked about the lower back and down into the legs as well.
My lower back, it starts at you would know better, L4, L5.
Yeah.
And it radiates all the way down through my left buttocks.
Yeah.
Almost all the way down to my knee.
Okay. And you've been experiencing that along with the headaches for how long now?
A little over 6 years.
Wow. And so you don't take pain medication. Are you on any medication for any other?
Yes, I am.
Okay.
I'm on. You have the list. I'm on a bunch of stuff for my brain.
Okay.
To try and regenerate.
Concentrate, right?
Mm-hmm.
Okay. Was there, with the pain levels and just your day-to-day functions, how did it affect you? Because you like to do a lot of lifting, right?
I do enjoy lifting. I enjoy lifting a lot, and it was really preventing me from accomplishing my goals of, you know, whether it's losing weight or getting stronger or anything. I couldn't do stuff because I was just in such pain.
Yeah.
And I came in for my first my first consult with you,
Mm-hmm.
and we went over everything. And the Army and the VA said that I needed back surgery.
Wow.
And I've done a lot of research, and there's always failed back surgery.
Mm-hmm.
You know that as a doctor.
Yeah.
And I refused to get the surgery.
Okay.
I said, I'm going to take a different route. And that's how I ended up coming to you.
Awesome.
And ever since I've been coming, my headaches, I don't have them anymore.
That's amazing.
I, it's the first time in 6 years that I don't have headaches. And with the amount of brain damage I have,
Yeah.
I mean, I should have headaches, but I don't anymore. And it's amazing. It's just, it gave me a new lease on life. It really did. Like, I wake up happier. I go to bed happier. During the day, I can take my dogs for a walk. I couldn't walk any farther than 40 yards before I came in here.
Uh-huh.
I wasn't able to do it.
Yeah. And now?
Now I'm great. I take the dogs up to Pie Trainer in North Park, and we walk around the loop.
That's awesome. Jake, I really appreciate you taking the time and sharing that story, because that's just so inspiring for other people who might be on the fence, might be nervous about trying an alternative route such as chiropractic care. What would you tell someone who is nervous or anxious about, seeking an alternative from medicine, seeking something like chiropractic care, and getting themselves analyzed and checked out? What would you tell that individual?
I would tell them not to waste any more time. Don't live in pain. I did it for so long, and I kept on putting it off and putting it off and putting it off. And whenever I couldn't get out of bed one day, that's when I knew it was time to, I didn't want them doing back surgery. I'm 32. Once again, I'm 32 years old. There's no reason for me to have back surgery. And I tell people, just don't wait. Go in, come in here. It's not that hard. You get a scan, you get some x-rays. Dr. Dan will tell you what's wrong, what needs fixed, and it turns out that we're going to be able to fix my back without any invasive surgery. So people just need to, they need to turn to chiropractic care before going to, let's say, the surgical
More
route.
invasive, yeah, the more invasive.
Horrible.
And it's not that I always say it's not that surgery has a time and a place, but try the less invasive approach first, and that's what you decided to do. And look what it's done. What did you tell Rachel after your first adjustment? Why did I wait so long? Right?
Yeah, I did. I told my wife. I said, "Why did I wait so long?" For the first time, and I don't know if I can do this on camera or if I'm allowed to. For the first time in 6 years, I can cross my arms. And before I started coming here, I couldn't do that.
Yeah.
My back was just, I don't even know, you would know better than I do. But
very locked up, right?
I couldn't move.
Yeah.
I was very immobile, very unflexible. And I just don't want, I think people should not wait. Go see a car, come in, just seek other means of medical attention.
And really, and that's the big thing why I wanted to share your story, and thank you so much for the time. It's just giving people the understanding that there are other alternatives out there, and at least go and get yourself checked out, get that second opinion, right? Because if it's there and we can help you, what a difference in life it's going to make, right?
I wake up, I'm not in pain, and it's weird because I've been in pain for so long.
Yeah.
And it's like a new normal. I feel great. I'm happy. I'm more active. It's coming along really, really good. I'm really excited about the results in the future.
Yeah, where you're headed.
Yeah.
Jake, thanks so much for taking the time. I really appreciate it. And thank you, first and foremost, for your service.
Thank you.